We got the article that everybody's been waiting for. Russia Today. Ow, the mandatory vaccines. They're gonna tie us up, snatch us out of our house, and make us take the jab. Yeah, what up? It's your boy Rob, coming back at you once again with another video. So before we get started, you already know what to do. If you're not subscribed to the channel, make sure you hit the bell icon twice. Smash the like button, share this video out to all of your followers. Watch the video all the way through to the end and click all of the links at the end of the video, all right? This is Corona Black Light. All right, on this channel, what we do is we talk about all of the new developments that go on with coronavirus, but guess what? We talk about them from our perspective, all right? So let's actually get into it. We got a little bit of diversionary justice, a little bit of diversionary social justice popping off, and we got a little bit of vaccine mandation popping off, all right? So let's actually look at these articles and see exactly what is going on. And remember, if you find any interesting developments with coronavirus, any interesting things that your state or your government might be doing, any questions or anything like that, hit the about page, send your boy content, all right? And make sure you follow my other channels, Blacklight Revelations, all right? Vaccine boosters become a potent symbol of pandemic inequity. Now, I got a couple other things that were symbols of pandemic inequity. Remember, the pandemic made a lot of billionaires rich. Yeah, I said that. It made a lot of billionaires rich because it blew a hole not only in the elite middle class wealth gap, it completely exponentially logarithmically increased the black-white wealth gap, because wasn't none of those billionaires who got rich black. So now what we are doing here is we're taking the focus off of the injustice that we have in the United States, and we're gonna say, well, listen, black people, we don't have time to deal with you. The whole world is dealing with this. And, you guys had 400 years to get it together, so we have to worry about people that don't have any access to the vaccine that nobody wants here. So let's actually see what this article from the Washington Post is talking about, shall we? Vaccine boosters become a potent symbol of pandemic inequity. You're reading an excerpt from today's Worldview newsletter, and let me tell you something. This is a great newsletter. All right, it is from Washington Post. All right, they're amazing. I break these articles down and show exactly how much nonsense is in them. I love doing that. All right. Vaccine boosters are fast becoming the ultimate symbol of pandemic inequality. While much of the world struggles with producing doses of the coronavirus vaccines, leaving health workers and other vulnerable people at risk, some wealthy nations are considering boosting the immunity of fully vaccinated people further with another shot. Now, you got to ask yourself the question, why would they do that? It's because of that Delta variant. That's why. All right. But they will face opposition. The World Health Organization on Wednesday called for a global moratorium on booster shots until at least September, pointing to the urgent need for doses in poorer nations. We cannot and should not accept countries that have already used most of the global supply of vaccines, using even more of it while the world's most vulnerable people remain unprotected. WHO Director General Tedros Adhanom Ghebreyesus said at a media briefing. All right, now here's a tweet from Reuters. All right, and it says, this is that guy's name, WHO chief He called for a moratorium on the COVID-19 vaccine boosters until at least the end of September to enable that at least 10% of the population of every country was vaccinated. All right, so this is some of that global socialism coming from the World Health Organization. We don't need to listen to this guy talk, you know what I'm saying? I'll leave a link in the description box if you want to listen. The WHO had previously pushed for a target to get 10% of each country vaccinated by the end of September. In some countries, that target has been easily surpassed. By July 23rd, both North American and Europe had administered at least one vaccine dose to nearly half of all residents. But others lag far behind. Just over 2% of Africa's population had been vaccinated at that time, according to figures compiled by the Washington Post. So this is where we throw black people into it. We're going to talk about Africa. All right. Some experts fear that a rush for booster shots in wealthy nations could further upend an already unfair distribution of doses, despite their recent donations of doses to nations with less vaccine access. The message to foreign health workers would be bleak. You see, the United States vaccinating is very healthy young people and planning on giving boosters to the elderly. You just have to shake your head and say, oh, well, it's nice you're giving me a few doses. Lawrence Gostin, professor of global health law at Georgetown University Law, told the Post this week. It's just exacerbating. Yeah, I bet. But with the rise of new variants, which we all know as the Delta variant, the push for additional shots is building in well-vaccinated countries. Booster shot campaigns are already underway in Israel and Russia and are likely to start soon in parts of Europe. Germany, France, and Britain have all announced plans for booster shots for certain segments of the population, and the Post reported this on Wednesday. The United States has yet to recommend booster shots, but that may not be far off. Those who are transplant patients, cancer, chemotherapy, autoimmune diseases, and those on immunosuppressant regimens, those are the kind of people that if there's going to be a third booster, which might likely happen, would be the first among the vulnerable. Anthony S. Fauci, the nation's top infectious disease expert, said during a CNN interview in late July. That's another thing too. Fauci, my opinion, I don't know about that, dude. How do you guys feel about Dr. Fauci? You guys feel he's legit or no? Let me know in the comments, all right? I'm always curious to see how people feel about these kind of things. I've never been a fan of Fauci. Before I did the coronavirus spinoff channel, I used to put COVID-19 content on my main channel. But, after I got it monetized, I said, listen, man, I'm not about to, put my channel in jeopardy by, dropping my opinions on coronavirus. I just make a little junk channel and, you know what I'm saying? I talk my stuff there. Now, I did videos where I talked about Fauci and a lot of the inconsistencies, but what I want to know is how you feel about him. And, if you guys have anything interesting, get it to me so I can make the content, all right? Most modern leaders acknowledge the disparity of vaccine supply, but they remain focused on their own populations. It makes sense. These are the people who voted them into office. Possibly within a relatively short time, could vote them out again. Plus, with concerns about vaccinated people also spreading the virus. And again, this concern comes with the Delta variant. All right. Personally seeking a third shot to protect vulnerable family members or children may not be necessarily selfish. But for the drug companies that develop the vaccines, money may be a powerful motivator. Oh, you think? My question is, anybody watching this video, do you agree with this statement? Is money a motivator? Yeah. In July, there was an unusual public spat between Pfizer, along with its German partner BioNTech, and the Department of Health and Human Services, with the U.S. agency resisting the drug company's argument that additional doses may be needed. At the time, experts expressed concerns that drug manufacturers could play a biased role in the debate about the data for the booster shots. Well, they could be playing a biased role in everything. A lot of these people involved with coronavirus could literally be playing a biased role in every damn thing, okay? One report by Bloomberg Intelligence in May found that booster shots could represent an $11 billion to $37 billion market each year globally. Now, I want to ask my audience, that's a big market. What should we be looking to invest in? Coronavirus technology, one of the reasons why I created this channel. Booster shots for wealthy nations are likely to be more profitable than initial shots in poorer nations. For its first 1.3 billion doses, Global Vaccine Sharing Initiative, COVAX, said that it had paid an average of $5.20 per dose. So multiply that times 1.3. All right. So, if you got basically 1.3, so that'd be like 1.5. So that's like, I want to say like 7 million, about $7 million or 7 billion. I'm sorry. That's a lot of money. Pfizer's initial cost in the United States was $19.50 a shot. And that price is expected to increase. So what does that mean? That means that Pfizer is going to be making a lot of money. All right. Pfizer is going to make a lot of money on this. All right. Global experts are united in calling for equitable distribution of vaccines. So, what we're doing here is a little bit of socialism here. They warned that leaders risk tackling short-term problems in place of long-term disasters. Scientists have warned again and again that allowing the virus to circulate unmitigated in poorer nations could allow potent variants to develop, not only threatening these nations, but much of the already vaccinated world. Delta, the variant most widely discussed right now, was first identified in India, a nation where slow rates of vaccination had left a population ripe for infection. Another variant raising alarms is LAMBDA. All right, so we got a new variant of COVID, LAMBDA. All right, now my question is, had you all heard of the LAMBDA variant? It was first detected in Peru in August of 2020, so they knew about this for a while. And if you go back and watch my content, they've been talking about these variants for a long time. And quickly spread through much of Latin America. Vaccines still work well against these variants, but will they work against the next or the one after that? Scientists simply can't say for sure. All right. The impact on health workers and other vulnerable population in the developing world could be severe. It is also preventable. In the United States alone, vast numbers of doses are simply wasted when they could have been used. Stat News recently estimated that some U.S. states already had millions of excess doses, many of which were likely to expire before they could be used. And if you remember, I think it's Pfizer and Johnson & Johnson requires very cold refrigerators. And there was a refrigerator shortage, and nobody ever said what went on with those refrigerators. So if you got some spare time and you're looking for some articles, do your boy a solid. See if you can figure out what happened to those refrigerators and send your boy the info, all right? Robert Ator, the head of the vaccine distribution drive in Arkansas, said that the state had so many doses, things were starting to get a bit silly. Ator told the health news focused website that his state was drowning in this stuff. All right. Vaccine donations can make a difference. The United States has sent more than 110 million doses to 65 countries. President Biden announced this on Tuesday. But while experts have cautiously praised these gestures, they've made clear that they do not go far enough. Beyond such donations, experts say nations could move towards more powerful structural changes. For example, by sharing the technology behind mRNA vaccines. Though there is fear, however, that potential variant could limit future generosity. We have a supply for every single American, Biden emphasized on Tuesday. Indeed, the United States has more than enough. According to tracking from the Global Health Initiative Center at Duke University, the United States has produced over 1.6 billion doses so far, which works out to be about 5.21 doses per inhabitant. Vaccine boosters, along with wasted doses, that put that amount at risk. All right. So, what I find interesting is that this really didn't say anything about being a symbol of pandemic inequality, because I don't know if anybody is aware of this, but the fact that you have difficult access to a vaccine is not the only thing that causes inequality. I don't know if they're aware of that or not, but now they are if they listen to this video. So now we got the article that everybody's been waiting for. Russia Today. Ow, the mandatory vaccines, they're gonna tie us up, snatch us out of our house and make us take the jab. Nah, that ain't exactly how it's going down. However, the United States military, the active duty, is actually required to get the vaccination. Now, I got a question. If there's anybody who is in the military, was in the military, or is planning on going into the military, how do you feel about this? What do you think about this? Thank you for your service. By the way, roll your sleeve up. Seriously? The Pentagon is poised to make COVID jabs mandatory for all 1.3 million active duty troops, as only 64% vaccinated voluntarily. Now, what I find interesting about that is that I thought the target rate for a population was 70%. So if we're talking about the military, 64 is pretty close to 70. Oh, man. I'm so sorry, y'all. I don't know why, but it happens. I can't stop yawning. All right, so let's actually get into this. Defense Secretary Lloyd Austin will issue a coronavirus vaccine mandate for the military's 1.3 million active duty personnel in the coming days, according to multiple reports. All 3 jabs remain approved for emergency use only. The Pentagon head is expected to announce the new mandate on Friday after making a recommendation to the White House. Fox News reported this on Wednesday night, citing officials familiar with the matter who declined to be named. Another defense official told CNN, meanwhile, that Austin's inclination is towards making the COVID-19 vaccine mandatory for the troops, which is the outlet, adding that a final decision could come as soon as this week. The New York Times corroborated those reports on Wednesday, also citing officials. President Joe Biden recently said he had directed the Defense Department to look into how and when it would add the COVID-19 vaccines to the list of those soldiers that they're required to receive, saying that at the time that Austin was open to the idea. The Department of Justice previously concluded that Biden would have to issue waivers for the 3 COVID vaccines currently in use in the United States, as they have all been approved for emergency use only by the Food and Drug Administration. Both Pfizer and Moderna have already embarked on the process to seek full authorization for their vaccines. Pfizer is expected to cross the finish line first, with reports earlier this week suggesting that the FDA could give its rubber stamp by early September. While coronavirus vaccines have not yet been ordered by the military, the Pentagon's Deputy Press Secretary Jamal Brown said last week that the department would ask all personnel to provide their vaccination status. Those unable or unwilling to take the shot will be required to wear a mask, physically distance, comply with a regular testing regimen, and be subjected to official travel restrictions, Brown said, though he added that Austin was already looking into a full mandate. Secretary Austin will begin consulting our medical professionals as well as the Joint Chiefs of Staff to determine how and when to make recommendations to the president with respect to adding the COVID-19 vaccines to the full list of requirements for military personnel. The military says that around 64% of active duty service members have been fully vaccinated to date. However, hesitancy towards the vaccine has been stronger in some branches than in others, with official data in April showing around 40% of the Marines refused to be vaccinated for a range of reasons. On the heels of a revised masking guideline from the Centers for Disease Control and Prevention, Biden announced last week that all federal employees would have to be vaccinated, or else face regular virus screenings in order to continue working. The move came as an abrupt reversal, as the administration previously urged agencies not to require the vaccine. While Biden also vowed to never issue a universal vaccine mandate for all Americans, concerns were raised that he would make a similar about-face last week after his CDC director, Rochelle Walensky, said the administration was looking into exactly such a policy. She later walked back the comment, however. All right. So my question for you all is, what do you think about this? What do you think this implies for the future? I don't know if you guys have heard about what's going on in New York, but in New York, they're making people show proof of vaccination, all right, before entering facilities, all right? Now, again, I'm just asking questions, right? You should be allowed to ask questions. So my question is, what do you guys think about this? Where do you see this going? Is this going to be something that's going to forever be a part of our lives? Or will we be able to get rid of it? I don't know, but I'll tell you one thing. That is the end of the video. So if you enjoy Corona Blacklight, make sure you smash that like button. Make sure you leave your boy a comment, all right? And remember, on this channel, we will be live streaming once a week, all right? So when you see the premiere window for the videos, or when you see the premiere window for the live stream, make sure that you not only have the bell icon hit for the channel, but hit the bell icon for each individual window. Otherwise, you will not get a notification, all right? And when you watch the videos, make sure you watch the videos all the way through to the end and click the links at the end of the videos. Help your boy out, all right? So with that being said, that's the end of this video. I hope you all enjoyed it, and I will catch you on the next one, all right? Peace!